Stories of dozens of babies dying in labor wards, cancer patients with no chemo, a desperate need for outside humanitarian intervention. The Venezuelan opposition is pushing it, the media is full of it. So once again, is it true? Well, here is one hospital that definitely isn't collapsing. The Pérez de León Intensive Care Unit in low-income Petare is well-equipped and spotless. It was set up under cooperation agreements with Cuba and China. It has had problems with saline solutions, disposable sheets, surgical pads, but they've always found alternatives or made their own. The director calls problems opportunities. For Venezuela's biggest maternity hospital, Concepción Palacios, the situation is certainly worse. Broken light bulbs, wards closed because of leaks, fewer beds because the air conditioning needs to be replaced. Pro-opposition doctors have used this hospital as an argument for declaring a humanitarian crisis. Yet more babies were born here in the first 4 months of this year than at any similar period in the last decade. Sometimes they don't have some drugs, but they insist babies are not dying as a result.
Mire, de verdad, yo no le puedo decir que no se nombre un niño porque no le di un medicamento. No, los tenemos, en este momento los tenemos.
Infant mortality in Venezuela fell by almost half in the first decade of the Bolivarian Revolution. In the last 7 years, it has crept back up a bit, but it's still well below the Latin American average. Nobody would deny that Venezuelan healthcare has problems, but claims of collapse seem, well, exaggerated. And behind this dispute lies another one, still unresolved, between a new, preventive, community approach to medicine, which Venezuela has embraced through its Barrio Adentro health mission, and the drug-addicted commercial model brought to Venezuela by 100 years of oil and US influence.